Good afternoon to everyone, and thank you for inviting me for this presentation. It's a very brief presentation. I prefer maybe as to have Q&A and explore things as people would see benefit for them, really. Um, I have been working for more than 10 years now at Phoenix Unit as a clinical psychologist, and I've also in between developed my training in psychoanalytic psychotherapy. Matt, if you could please move forward. From a very early on, I started developing a reflective practice group in the unit. So it's an inpatient unit with 16 beds in Southwest London, St. George's Trust, for people mainly with a diagnosis of schizophrenia. And I see my role as a psychologist is also not only supporting staff and patients, but also the family members. So there's these three sort of roots, really. And in terms of staff, and we have from very early on started a reflective practice group, which aims to sort of develop psychological awareness through self-reflection. It's very much focused, of course, on our policies and documents in all sorts of different CQC and mental health development and nice recommendations. And so I'm sharing the slide, so it's there, it's self-explanatory, but it is basically to help staff feeling supported in terms of a psychological understanding of the clients they work with, the family background. So it makes sense why a psychotic episode would happen, but also a detailed history, so that can inform better our care plans from the nursing point of view, occupational health, and psychological work. So I've been, in a way, it's been a pleasure to been working with this work and with this staff group, because although we have some staff turnover, we have sort of maintained a steady group of staff. And I think, sometimes one thinks that there's a magic potion, but I think in this case, it's more the sense of, a consistent, structured approach with a staff group that can be an anchor and a containing aspect to the clients we work with. Matt, if you could get to the next one. Thank you. So the setting of the group, I initially met up with the different disciplines and discussed with staff how they would like to see the group happening, how often, and the members of staff agreed that once a month, every 4 weeks, would be a good frequency. We also discuss the length, so it's normally an hour, 45 minutes, between 45 minutes and an hour. And the issues that we tend to discuss, mainly how to focus on the care plans of the clients and how to develop them in the best way possible, from a psychological understanding and in terms of identifying the strengths that the client presents and the difficulties that need some support. So the reflective practice group has this component of a case sort of formulation. Sometimes it has other issues like debriefing, if there is a violent incident or a difficult disclosure or a client passing away. So there's also a remit in that group for those discussions and support of staff to take place. And but mainly, yes, it's staff self-reflecting about how they work with a particular client and what kind of feelings, what kind of thoughts they have about to improve their relationship and their care. In terms of the difficulties and challenges and what since we started the sexual safety project years ago, initially staff were very resistant. They seemed very uncomfortable about discussing any issues related with sexual safety, and it has been, again, there's no magic potion. It has been a slow process of bringing up. I made the decision, although normally staff decides what themes they want to talk about in a session, but I made the decision to make it part of the agenda. So I would bring up at the start of each session if there's any sexual safety issues. I think when one works in an inpatient unit, in a way, we become a bit like a family. This becomes, a house, a home, hopefully, for the clients. So there is a sense that, in a way, even sexual needs need to be become much more pertinent and need to be addressed. So we slowly I've brought that up, and the nurses in particular and healthcare assistants have been slowly adhering to the idea that it's really important to have a very thorough life history, trying to look into signs or symptoms that may disclose some emotional, sexual abuse in the past. We know that people with psychosis possibly have had in the past, and maybe sometimes camouflaged with the delusions, so we try to incorporate that, and slowly and gently, by providing a safe environment for the clients, but also for the staff to slowly explore these issues. The difficulties in terms of the staff support are the members of staff who have very strong religious beliefs, and somehow they feel as if opening up to this area would be something very difficult, as if they would be breaking their religious beliefs. And it's an ongoing work, but because we have given some leaflets, so much information, and a booklet about sex and your body that we gave to the clients and also to the members of staff to have a look through. And so there's tools that have helped staff to address these issues, because it still startles me sometimes that we don't ask female patients about their sexual health, and in terms of, for example, their periods, if they are aware, if they need help, if they need support, or for example, male clients, that the medication may have an impact on their sexual energy and drive, and so again, it's gently trying to open up these doors, and as I said before, this is in a way their home for a couple of months, so we need to be able to promote, and particularly with the idea of trauma-informed care, that people have been sexually abused in the past, and therefore again being able to support the clients that we have to start to open up and to address that trauma. Where are we now? And I I think it has been a very slow process of staff feeling supported and being able to discuss these issues with the tools that developed together with the sexual safety cards. And so that there's been a culture in a way growing up in terms of this is not taboo. It may not be easy to address for some people, but we can talk about it's okay, and gently exploring these issues with clients has been very helpful. And the service users, the clients are opening up a lot more to make a bit more of a bridge between sexual safety and trauma-informed care, as I was saying. Certainly, we're starting with very thorough background, life history, so that we can inform our care plans, and slowly starting to opening up areas of difficulty and trauma, particularly associated with sexual abuse. Matt, if you could move on, please. The slide is just, I think it has been shared already, but yeah, it's one of the achievements that I feel quite proud is that we did find it. The booklet wasn't developed by me, but someone else. I think I shared with Emily already. But we put it into place, and it has been quite another supportive tool in terms of making a link between staff and service users to start to opening up a dialogue. And has been very helpful for both staff and service users alike. So that's where we are at the moment. Yeah, I'm open to questions and answers, really. So that's where we are with the Phoenix unit and our sexual safety kind of collaboration with staff and service users.